Hello, and welcome to TEC Talk Community Conversations, the regularly scheduled broadcast from Dr. Jill Bowen, Commissioner of the City of Philadelphia Department of Behavioral Health and Intellectual Disability Services, in which we explore how the work DBHIDS and our partners do aligns with the key components of TEC, which stands for trauma, equity, and community. So now let's learn about TEC. Dr. Bowen?
Thank you. Thank you so much, Mark. Good morning, all, and welcome to TEC Talk Community Conversations, the video series in which we explore how the work we do at DBHIDS and with our community providers and partners aligns to address trauma, achieve equity, and engage community. TEC. Today, I am so pleased to be joined by Asher Kemp. Asher is the Executive Director for the Coalition of Culturally Competent Providers, CCCP, where he has helped serve the people of Philadelphia for the past 7 years. Asher, welcome. And why don't you tell us a little bit about your work here and how it aligns with the priorities of trauma, equity, and community?
Great. Thank you, Dr. Bowen, and good morning. So the first thing I'd like to say is, again, thank you for having me. And also, too, just thank you for putting a platform like this together. Not only does it give opportunity to showcase the resources within Philadelphia in terms of our community partners and also the work within the city, but it also works to break down the barriers and stigma as it relates to mental health services, and hopefully continuing to create an atmosphere for accessibility and people accessing more mental health services when it's needed. So I like to think about the Coalition of Culturally Competent Providers and how we frame things as looking at it from a macro point of view in terms of our services. And so our services are necessarily done through the organization of mental health and human service providers that work with us and that are members of the coalition. And so the coalition was created by a group of mental health human service agencies that came together to create partnerships, sustainable models of cultural competency for policies, programs, and services who collectively serve over 100,000 people in the city of Philadelphia and the surrounding counties. And our membership is comprised of 20 members, and those 20 members are key resources within the communities they serve.
Well, so the alignment with equity is really evident. Can you say a little bit more about what the driver was to create a coalition specifically focused on cultural competence? So critically important, we know, and terms that we use, but let's dig a little bit deeper to understand it a little bit more.
Some of the emphasis of why it was created. And so one of the things that has always been a challenge, and I would say it is what it is in terms of no particular outline in terms of how the services are rendered. As the members in the coalition got into providing services and working with the individuals that they work with, they realized that not a lot of the services that they were providing or needed to provide for those families dealt with trauma, dealt with equity, dealt with achievement, and they wanted to look at how they can form an organization to really address those things in a systematic approach. And so within our systematic approach, and that is the key thing within what I said about our partnerships, within our partnerships, we also look at what we call the social and emotional determinants of health, which also affects our individuals who come into the doors through these agencies for services. And so our partnerships are with PICO. And so we are able to develop almost a one-stop shop in some aspects within our provider network by being able to offer these services. And so when you have a family that not only is having some mental health challenges, but also having some economic challenges, that also continues to impact on your mental psyche. And so it's great that we have that partnership that we can enroll a person right there that's coming to one of the mental health agencies, and they can enroll them to receive a service through PICO that may even forgive their bill or even come in and weatherize their home for free. Another key partner is the Fair Housing's Rights Center of Southeastern Pennsylvania. And so when you have consumers that are having housing issues or issues with their landlord, how, thinking about, having a stable home is important. It's important for everybody in the family to have a stable home. And so how important is to be able to have someone that you can pick up the phone and also can call and advocate on behalf of that individual. And so those are some of the things. And I can go even into more.
But so very, very clearly, I mean, social determinants, drivers of behavioral health and behavioral wellness, so critically important. And so this was part of the founding tenets of CCCP to be
Yes.
focusing, as part of awareness of the challenges and the barriers and the stressors that we now really talk about as automatic, but not necessarily perhaps when you stood this up to think about a behavioral health provider as ensuring something like housing and energy access, and all of these other social drivers that have such tremendous impact on people's ability, one, to be able to benefit from treatment, but just in general to be able to have a certain degree of wellness. And so your members, so being a member of CCCP means being committed to these approaches. What does it mean to be a member, and how do providers actually enter the coalition?
Sure. So it's an open membership, and it's in line with anybody that cares about working with communities, about the overall health and wellness of communities of color. And that's the fabric of how the coalition was created. And to talk about the in line in terms of our members are, I would say, this extremely innovative in their approaches. And so I'm going to give you an example. When the pandemic hit, a lot of us were just totally lost because we have never experienced anything like this unless you were around for the plague, which I don't think anybody was currently now.
Really?
And so it was like, what do we do? What do we do in terms of what people need and what? And so our first aspect was to do an educational forum for parents, because a lot of parents were having to work with their children at home and balance workout. And so we created a forum, an open forum with the Philadelphia School District, charter schools, private schools, and schools that specialize also with children with intellectual disabilities, school psychologists, school counselors, to create a format where it was open for parents to come in to hear things of how they can help their children, and also giving them resources available, and also giving them phone numbers to call if they needed help. And so when you talk about the coalition, I like to think of us as really being on the front edge and really continuing to be innovative in our approaches of what we are looking at for the city of Philadelphia.
That's great. And clearly when you raised the pandemic, that's clear trauma. I mean, there's
Yes.
no question of the contribution of COVID to trauma, to the families being somewhat disconnected from community, the kids being disconnected from their peers in the schools. And I think we're still seeing, and will continue to be seeing, the impact of that in our communities. And then there's the institutional trauma. And the systemic racism, and all of the poverty, and some of the things we had been talking about before when you talked about access to social drivers. But there's also trauma, and layers and layers and layers of trauma. And I wonder if you could speak about that from your perspective and from the perspective of CCCP, and how you work with the people that you serve in those, with all of that in mind.
Sure. So I want to talk about it from the perspective of systemic trauma. And so I'm going to go back to a situation that happened. And so when the NFL, members of the NFL were protesting by taking a knee, became very controversial. And a lot of people saw this not being patriotic. And so the coalition decided to really talk about what was going on. And it was not about people not being patriotic, but it was about that they did not feel as though they were valued within our society. They did not feel as though that they were being allowed the same access. They did not feel as though that people took them seriously, so they experienced discrimination and inequities. And so we really wanted to bring that to light. And I would say that that was one of our biggest events. And I think that was about 5 years ago, where we rented out one of the hotels on City Line Avenue, and we had an open panel discussion for members of the community to come in and just to talk about their feelings. So the other thing about that, when it happens, is you get a chance for people to release that. And not only that, when you put a format together of mental health and human service providers, you also have the resources that people can connect to that has been holding these things so long on their chests.
That's fantastic. And it segues directly into engaging community, which is clearly at the center of all that you've been talking about, is how to engage the communities. And I'm interested in your thoughts about neighborhood by neighborhood by neighborhood, and how to engage, the particular, culture of a particular neighborhood in Philadelphia, which is so very much a city of neighborhoods, and what is the approach to being really specific around the challenges, neighborhood by neighborhood.
Sure. So, and again, you have to look at it from a systems-based approach. And so you have to understand the needs of that particular community. And if there is a subculture within that community, you also have to understand the psychological needs of all individuals. And so when you talk about the psychological needs of all individuals, that may be work opportunities, that may be educational opportunities, that may be fair housing opportunities. And so then you have to develop a comprehensive program that really addresses the needs of that individual community, even though there may be some similarities in terms of communities as a whole within Philadelphia. But you have to take time to understand that community. And, this is something that's really important to me, because a lot of times when I have done community work, people are fearful of people coming in their community because they're afraid of what they're going to do or how that they're going to promote their community. And so the other thing you always have to remember, there are strengths in every community. There are strengths within the relationships, and you have to look at how you build on the strength within that community, but also look at what's functionally the right way, and what things you may have to change differently to add some resources to that.
Yeah, that's incredibly helpful, and appreciate that. And also, your member providers are in the community, serving the community in several different several different neighborhoods. They're embedded, which is really, I think, advantageous, of the community, serving the community. And I'm wondering if you can talk just for a little bit about what you're looking forward to as we move forward through the summer and into the fall next year. What are you looking forward to as we go forward through this next year?
Sure. I'm looking forward to opportunities for our members. Recently, the coalition has submitted a proposal for funding for $4 million. And so within that funding, our goal is to be able to give many grants to our members in terms of supporting some of their initiatives within these communities. And, you know, because we know that not all the programs are able to do everything. And so we wanted to be able to have that funding to complement some of the other services that they're doing that they know is needed within that community. The other thing is that for the coalition is evidence-based is really important for us because it gives you a theoretical framework in terms of the practice of what you were doing. And so continuing to develop ways to research best practices and also to continue to develop a competent model of care for individuals that includes the whole person. And so the unique thing about the coalition is I talked about it from a perspective, we are not just mental health providers. We are health and healthcare providers as well. So to have a system where you are able to treat the whole person is important. And I have always believed in that since I entered the field, and I'm not going to date how old I am, but 30 years ago. I have always believed in a holistic approach to servicing the whole person.
That's really, really wonderful. This is such a great conversation. I wish we had more time because I think I could stay on with you for hours. But we are going to wrap. I think that Philadelphia and for sure DBHIDS is very fortunate to have the Coalition for Culturally Competent Providers as our partners here in Philadelphia. So thank you, Asher, for your time today and for the work that you and the coalition do for the people of Philadelphia. And thanks to all of you for watching the DBHIDS Commissioners Tech Talk Community Conversations. Our next Tech Talk will take place in August, and we'll have another guest to help us learn more about the important work our organization and community partners do to address trauma, achieve equity, and engage community. So once again, thank you, Asher Kemp, Tech Champion.
Thank you, Dr. Bowen, as well.